Thank you very much, Prime Time, for inviting me over here. There is a slight, correction to be made. I'm not a urologist. I'm a rheumatologist. So I take care of joints. If you have creaking joints, you have joint pains, you have arthritis, I'm the one who takes care of that. I was trained in medical college, Srinagar, and then did my post-graduation in Delhi, and then later on shifted to Hyderabad for my super specialty training, which is rheumatology. This is roughly 20 years back, or maybe 22 years back. That was in 2001 when I started my training. And there were hardly any training schools at that point of time which were dealing with rheumatology. So Hyderabad Nizam's Institute was one of them. So I got trained there. And at that point of time, this rheumatology, trained rheumatologists were very rare in India. I mean, this was a rare entity, sort of. And there were hardly any trained, around 80 or 85 trained rheumatologists at that point of time. So after completing my training in Hyderabad, I went to CMC Vellore, worked there as a faculty in rheumatology, and then came back to Hyderabad, worked there for 3-4 years. And after achieving enough expertise, I thought of going back to Kashmir. Now, Kashmir was at that point of time it was a politically unstable. Most of you would be knowing about it. And then starting a clinic, starting a new branch, which was alien to most of the people, was always difficult. So I started holding camps, which again was difficult. I started going to rural areas and holding camps and trying to inform people what rheumatology was. And that's how it started. But what I came to understand subsequently, that India's soul resides in its villages, and yet rural healthcare remains one of our most presenting and persistent challenges. Despite decades of policies, efforts, and nearly 65% of population still struggles with our limited access to quality medical care. The challenges are multifaceted. First, infrastructure. Many villages lack basic facilities like primary health center, and that it's true of almost every place in India. Now it's changing, definitely it's changing. And they hardly existed there. And if they were understaffed and poorly equipped. Second was the workforce. There's a chronic shortage of doctors, nurses, and specialists willing to serve in rural areas. And third was awareness. Low health literacy and cultural taboos often delay treatment, especially for women and elderly. And the fourth was the connectivity, poor transport, poor digital access, and this hinders timely care and emergency response. So these gaps aren't just logistical, they are deeply humane. A mother walking miles for a vaccine of a child and a farmer being ignored or ignoring his chest pain has to wait or walk to a nearest clinics which is hours away. These stories aren't rare, they are routine. So what do we do about them? First is strengthen infrastructure. Every village deserves a functional PHC or a primary health center with essential medicines, diagnostics which are up to date, and trained staff. That's very important. Mobile health units and satellite clinics can extend reach where permanent facilities aren't feasible. Second is incentivize the rural services. So offer financial rewards. Now what's happening is if a doctor is posted in a city, he gets city compensatory allowances, and once he goes to a village, those allowances are removed. So we need to do it reverse. We need to give them village compensatory allowances. So once they go to villages, and that's what I mean, that would be an incentive for them. They'll earn more there. And there are other financial rewards, housing and career advancement for the medical professionals who commit to rural postings. So telemedicine should be scaled up, not a substitute, but as a bridge. Third is empower communities, train local health workers, ASHA and ANMs, and volunteers to deliver preventive care, monitor chronic conditions, and educate families. Health literacy campaigns must be culturally sensitive and multilinguistic. Fourth is integrate technology into them. Digital health records, AI-powered diagnostics, and mobile apps can revolutionize healthcare if paired with training and infrastructure. And what we thought of doing, not we thought of doing, we actually did it. So we held satellite clinics. We kept a GP in various areas of of the state, and then a difficult patient, we trained him accordingly, and a difficult patient which he had to discuss with us, he would examine him, we would examine the patient, he would communicate to us, and then we would give a treatment which was sort of it would be a sort of teleconsultation, and that a bit changed the scenario, but not all through. So finally, it's very important, accountability is very important, what we need to understand. Government schemes must be monitored transparently, and there should be community participation. Public-private partnerships can bring innovation, but equity must remain the guiding principle. So rural healthcare isn't just a policy, it's a moral imperative. When we uplift the health of our villages, we strengthen the foundation of our nation. So let's not settle for patchwork solutions. Let's bind a system that honors every life, regardless of geography. Thank you very much.